So now we're going to talk about the anterior-inferior group. The anterior-inferior group of the sinus have a characteristic. All of them finish confluent in the cavernous sinus. As you remember, the posterior-superior group all of them finish in the aerophilus torcula. This group finish in the cavernous sinus. This group of the affluent finishing the cavernous sinus is going to be the joined together with the ophthalmic vein, superior and inferior ophthalmic vein, also the central retin vein, sphenoparietal sinus, intercavernous sinus, and the basilar plexus. So very important is from the posterior part of the cavernous sinus go these veins, these ducts. It's gonna drainage all the veins, all the confluence of the veins, and they're gonna finish in the sigmoid sinus. So this is in proper way, in definitely way. This is the collector trunk of all the veins of the sinus of the dura. Okay. So first we're gonna talk about the cavernous sinus. We're gonna talk in very basic way. This is gonna be a basic explanation. We don't gonna talk like surgical anatomy. Okay. So this topographic about the triangles we can talk in another video. First we're gonna say where we're gonna find the cavernous sinus. Okay, this is the first part. Where we're gonna find the cavernous sinus. As you can see here, we're gonna find the cavernous sinus around the sella turcica. We're gonna find the cavernous sinus around the sella turcica. There are from anterior to posterior gonna have 2 centimeters. I'm gonna have from superior to inferior 1 centimeter. This sinus is gonna rest anteriorly in the circle of the lateral surface of the body of the sphenoid. Okay. To each side, as I say, remember we have here we have the sella turcica. So, in the sinus have an areolar cavity. And in this areolar cavity is gonna go the carotid interna, artery, and also the abducens. But when it's not included in the wall of the sinus. So the lateral wall of the sinus is gonna be divided in two fibrous lamina of the this web, this venous web, as you can see here. This is like a venous web, trabeculous, or we can say like a web, a venous web, intermediate venous web. And we can consider this part like a superficial surface of the sinus. This venous web is sinusal laterally, and it's gonna be separate from the cavernous sinus properly. You can say this is the cavernous sinus properly, and this is the superficial lateral wall or the web. So it's gonna be a fibrous lamina, and it contains these walls gonna be included the oculomotor, the trochlear, and the ophthalmic nerve. So the cavernous sinus is gonna be in communication with the pterygoid plexus in the same area, in the same side, by 4 emissary veins. These veins go through the skull base from the foramen of the cavernous sinus. These veins gonna be in you're gonna find in the foramen ovale, also in the foramen rotundum. There is some inconstant foramen, is the venous foramen of Vesalio foramens, and also we can find it in the foramen lacerum. So again, we have communication extra. You can see, I don't have this picture, but you can see the usually people don't put in some picture this because these veins are very small. Yeah, but you can see here the communication. This is a pterygoid here, venous plexus, and you can see here. So this again, you can see a communication of the venous system, intracranial and extracranial. And you can see here a real picture of the cavernous sinus. And you can see here the venous plexus in the foramen. So now we want to talk about the affluent. The principal affluent, we're gonna start with the ophthalmic vein. This vein drainage in the affluent of the cavernous sinus, the superior and inferior, you can see here. The superior ophthalmic vein is gonna start in the middle angle of the eye. It has the opposite trajectory of the ophthalmic artery. Usually it's very tortuous, and it's gonna have the affluent also similar to the ophthalmic. We're gonna have the ethmoidal anterior and posterior veins, muscular superior veins. Sometimes gonna receive the inferior ophthalmic vein as an affluent sometimes. And the inferior ophthalmic vein, this gonna start in the inferior floor, lateral and inferior of the orbit. So the vein central of the retina is very small and is satellite of the artery, the central artery of the retina. It can finish or directly in the ophthalmic vein or directly in the cavernous sinus. The sphenoparietal sinus is gonna receive some diploid vein, meninges vein, or cerebral veins. The intercavernous sinus also is called coronary sinus, and you can see here. Yes, you can see here. It's intercavernous sinus. We have two intercavernous sinus, anterior and posterior. They also call it coronary sinus. So we have here the bachelor plexus. This plexus we're gonna find here in very related with the clivus. It's gonna have afferent branches. We're gonna receive the blood from the cavernous sinus, and also this blood go to the sigmoid sinus. Later we're gonna have the petrosus, superior petrosus sinus and inferior petrosus sinus. The superior petrosus sinus, you can see here, is go in the peñasco of the temporal bone in the superior border, and the inferior petrosus sinus go in the posterior inferior part of the cavernous sinus and go oblique, inferior and lateral. And as you can see here, it's gonna finish and go for the Petro-Occipital region and gonna finish the sigmoid sinus. The Petro-Occipital sinus, this one we cannot see it here because it's gonna be down. You're gonna find this sinus extracranially, okay? And in the region is in the posterior part of the cavernous sinus, is in the area, or we can say at the level of the foramen lacerum. And we can say in the last, we're gonna have the intercavernous sinus, the intercarotid sinus. The intercarotid sinus is, as the name itself it say, is around the carotid. Usually it's very hard to in a simple dissection to find it, because it's all over around the carotid.